Hello, everyone, and welcome to our very first LinkedIn Live. I'm Allison Van Wagnen, and I'll be your facilitator today. At Softheon, we work with dozens of payviders across on-exchange, off-exchange, Medicare Advantage, and now ICHRA. So we see firsthand the big shifts happening in government-sponsored markets. With so many changes coming this open enrollment, we've been having a lot of conversations with our clients, and we're excited to bring that expertise to the broader community today. We've gathered some of the brains behind Softheon to dive into the affordability threshold changes and what they mean for members. Let's kick it off with some introductions. Marc, why don't we start with you?
Yeah, thanks, Allison. I appreciate being here today. I'm Marc Bryant, Senior VP of Healthcare Solutions at Softheon. My background spans a couple decades now in both technology and business development, including about 10 years helping health plans make that transition to value-based care. At Softheon, I work with both payviders and plans to help them modernize their ACA, their ICHRA, their MA strategies to increase growth for the membership and also improve member satisfaction.
Awesome. Thanks, Marc. Let's toss it over to Josh.
Hi, everyone. My name is Josh Schultz, and I'm the head of government affairs at Softheon. In this role, I lead our government affairs strategy at both federal and state levels, focusing on health policy areas like the ACA, the marketplaces specifically, Medicaid, ICHRA, and Medicare Advantage. I work closely with policymakers, industry experts, and other leaders to ensure that Softheon is not only aligned with emerging policy, but is also positioned to help shape it. I'm really excited to be here today and look forward to sharing insights on trends and policies affecting the future of the ACA. And I'll hand it back to Allison.
Awesome. Thank you, Josh. Next, Lindsey.
Hi, everyone. I'm Lindsey Miller. I'm Program Director of Health Plan Solutions. And in that role, I really drive business strategy for all of our solutions that support our health plan partners. I've spent my career in health tech, from working on the Hill in DC to consulting for federal government contracts, working with health plans and providers, and now working at a technology company. I'm really passionate about creating an environment that makes healthcare better, easier, and more accessible for all stakeholders. So I'm really excited today to talk about some of the policy shifts that we have seen over the last few months.
Awesome. Thank you so much, Lindsey. Let's dive right in. So Josh, let's start with you. What are some of the major changes coming this open enrollment regarding eligibility that will impact payviders and, more importantly, members?
Thanks, Allison. There are really quite a number of things happening this open enrollment that affect the ecosystem that health plans and their members live in. The first and foremost is that there are enhanced subsidies, or APTC, Advanced Premium Tax Credit subsidies, that were created in 2021 and extended later, and they're going to expire at the end of the year unless Congress acts to extend them, and it's very unclear whether that will happen at this time. And if they do expire, the net premium, the premium that somebody has to pay after any government assistance, will go dramatically up, and it'll go up also for people above several times the poverty level. So, I actually don't know the numbers offhand, but middle income families are going to be significantly impacted by this. In addition, there are some new eligibility and enrollment rules that have been implemented or are under consideration at the marketplace level to verify income, require people to come back and re-enroll manually as opposed to automatically, and other changes from previous years that make a different environment for people approaching health insurance individually this year. With that, I'll hand it back to you, Allison.
Yeah, from the client lens, Marc, do you have anything to add?
Yeah, so we see for open enrollment, there's going to be three big eligibility shifts that are going to hit both payviders and their members. First, there's, as Josh mentioned, the new income verification rules and also expanded ICHRA carve-out. Carve-outs will pull some people out of subsidies that they relied on. So premiums will feel higher, even though technically plans are following the new formulas. Second, those premium increases will trigger more member churn, especially in markets that have tighter margins. That'll put real pressure on providers to keep volume and revenue stable. And then third, the resulting confusion will flood call centers and retention teams, forcing plans to really lean into proactive communication and support. So in short, we're preparing for a season of higher premiums, potentially higher member churn, and also higher service demand.
Yeah, and I want to jump in just with a little thought from the operational perspective as well. In thinking about that member outreach portion, there should be a big effort on the health plan side to really engage members, brokers, just the entire community in a proactive fashion, knowing that there could be some member abrasion down the road because premiums are going to be different. Subsidies are going to be different, and we don't know exactly what that's going to look like yet. And so the renewal notices that are going to go out are not going to have the full picture and the full information. So trying to outreach to members to say, hey, verify your information with healthcare.gov or the state-based exchange now so that your information is up to date when that first invoice finally hits. I think we're also working with our clients to script out call center FAQs so that all of the service reps are prepared to answer these questions and understand what has changed and why it has changed, along with some scenario modeling to figure out, where are those affordability gaps and how can the health plan best support their entire community, like I said, from brokers to members and their own teams.
We know that subsidies and the marketplace rates are shifting significantly, but what about group coverage? What are some of the challenges that we're seeing there?
There has for several years now been a trend of, in some states, not all states, but some states, the small group market for smaller employers has been becoming more and more expensive for stakeholders and less palatable for the leaders of companies to invest in. And instead of that, some are leaning into ICHRA solutions for their employees. And that is definitely a trend in the small group as well as large group markets. One of the things that's happening this year specifically is that the percentage of premium that employers can attribute to a particular employee is increasing, and so that will show on how much somebody has to pay for the basic amount of coverage. Finally, sort of as a global picture, the group market continues to shrink. Small and mid-sized employers are dropping out. And so we're going to see more and more initiatives through ICHRA and QSEHRA to find alternatives to group coverage, traditional group coverage.
Yeah, and let me piggyback a little bit off of what Josh just said there. Definitely, it's going to the effect is not just on subsidies. It's going to be real pressure on that group market, and many employers are already feeling stretched by the cost of traditional coverage, and that higher benchmark will continue to accelerate that shift towards ICHRA or defined contribution models as a sustainable option. From a payvider's perspective, we see it as a double-edged sword. There's opportunity in it. First, it's opening up that pipeline of ICHRA-funded members. If you have the right balance of enrollment, pricing, and service infrastructure ready to support it. But second, it brings in added complexity. It brings in tighter data requirements and higher churn in those thin margin markets. So as bottom line, as affordability threshold rises, payviders need to be ready for ICHRA in order to capitalize on the opportunity and support those employers with the pressure that they're feeling.
Brokers are on the front lines with members during renewal season. With premiums rising, subsidies shifting, and notices changing, how can Payviders best equip brokers to guide members through this complexity and prevent drop-off?
Is that for me, Allison? I think it is.
It is, yeah.
And Lindsey already kind of covered this to a degree in our views on the brokers. They're truly at the forefront of this renewal season. They're facing the higher premiums. They're facing the shifting of subsidies and the new notice requirements all at once. So we see it as the best way Payviders can keep members from dropping is arming those brokers with clear and usable tools. That means timely rate sheets. That means side-by-side comparison guides, plain language FAQs so they can cut through all that regulatory jargon quickly. It's also giving them concise talking points around affordability. So in real time, they can support those members without having to dig through different filings to try to find it. These brokers are small shops, as we know. They have limited bandwidth. Payviders are going to need to do that heavy lifting. Otherwise, other plans are going to fill that gap for them. So in short, reliable data, ready-made scripts, as Lindsey has said, and fast support are essentials for brokers and their members to keep them engaged.
Yeah, and one of the things that we've done recently here at Softheon is we've been having conversations with our user community around this very topic. In fact, just a few days ago, we had a broker portal demo on some of the improvements that we've made to try and help with some of these issues. So making it easier to stay in one spot for the broker, making it easier for the member to shop with a broker. But like I mentioned earlier, education is something that we see is really paramount. And our user community was really strong on that as well. There were a lot of conversations around how to engage the brokers, how to educate the brokers, and making sure that they have the latest information, making sure that they're sharing the same story around affordability that the health plans are, and really understanding that renewals are going to be different this year. And also encouraging the brokers to be proactive to reaching out to their clients and encouraging them to update their information and make sure that their income is up to date and all of their details are up to date in healthcare.gov.
And I'll just add to that there has been some ongoing concern for much of the past year at the federal government level, at CMS, about, we know that the vast majority of brokers are acting in good faith and working to help connect their customers with health insurance. CMS has expressed concern about a small number of brokers, some of whom aren't even really brokers, but just entities acting in bad faith, who have tried to switch people between plans that they didn't want to switch to, enroll people in plans they didn't want, and pocket a commission as a result. And so there has been some activity on the CMS side related to that that could have an impact this open enrollment as well.
That's true. And during the user community forums that we held recently, we did talk about consent management and making sure that the brokers are up to date with the latest consent management rules. And the health plans are at the forefront of helping ensure those brokers are educated and aware of what's needed.
So another big topic is renewal notices. With uncertainty as to whether Congress will extend the enhanced APTC, CMS is allowing plans to omit premium and APTC amounts from 2026 notices. How can Payviders strike the balance between compliance and clear communication? And what's at stake if members feel confused?
Well, I'll take the first part, the background and context. We talked about the potential expiration of enhanced subsidies. And in that context, a lot of people could be seeing bigger premium increases than they were expecting. And there's also no certainty about what people's ultimate premium will be as of right now, because Congress hasn't made a final decision about whether to extend or not extend those enhanced subsidies that have been going on since 2021. So as a result, CMS is allowing carriers to omit the information related to advanced premium tax credit, this is the federal subsidy, as well as premium information specifically, because all of this affects the overall premium as well. And there may be new disclaimers, discussion points, and areas where context are explained on the notices that are going out this open enrollment. But it creates a very confusing and new challenge for health insurers and the ecosystem they operate in.
Those are all really good points, Josh, and things that our user community discussed recently around how are we going to handle renewal notices? What are we going to provide? What information should we list? Because that's a big concern. So the ultimate decision from the group was to go ahead and omit rate and subsidy information at this point in time, with really clean, clear, plain language disclaimers that encourage members to update their information. And also, health plans are not going to be relying solely on these paper renewal notices, but also leveraging digital formats and even community events where they can get in front of community members, especially as payviders, which are local presence in their communities. You can get out in front of them, leverage the provider networks, leverage the broker networks to make sure that everybody is up to date and knows to go update their information.
Lindsey, you were on with Spring Street Exchange a couple of weeks back, and a metric really caught my attention. 51% of healthcare organizations are actively pursuing new and innovative revenue opportunities beyond traditional offerings. Let's break that down. What does that mean for the market?
I think that this really reflects that there's a need to diversify at this point in time. We can't just focus on the individual market or the group market, as we've spoken about earlier today. We're looking at ICHRA, supplemental benefits, even provider-sponsored payments. So having the hospital or the provider provide coverage or provide that payment for the member so that they can receive benefits, and different ways that can all connect together, because it's not just about revenue at this point. It's really sustaining the mission and driving access, which is really important to me and part of my personal mission throughout my career. So any way that we can support through communication, education about different options that are out there and keep the payviders going.
Yeah, and I'll add to what Lindsey was hearing. It just shows again how fast that market is shifting, and ICHRA seems to be the fastest growing runway for it. So as a payvider, I think there might be three good opportunities in this space. First, as administration as a service fees for enrollment, contribution, tracking, and compliance. Second, if they're able to bundle ancillary products together like telehealth, wellness, supplemental riders into their employee fund pool. And third, risk sharing or value-based care contracts, where I came from, and in turning that employee contribution into shared savings. So in short, that 51% figure tells us that the market's ready to monetize ICHRA's flexibility, and payviders that package admin, package add-ons, package outcome-based deals could be in great position to capitalize on that growth.
Thanks, Mark. Next, we're going to move to some audience questions. And just a reminder, if you do have any questions, please drop them in the chat. If we don't have time to get to them today, we will be in touch with you with some answers to your questions. So first question for each of you is, what is one piece of advice for plans going into this year's open enrollment?
I'll go ahead and start. I would say stay plugged into regulatory shifts. There are court cases There's there are new regulations that apply to the marketplaces. As Mark before me mentioned, there are ongoing evolutions in the way that ICHRA is utilized by a variety of different stakeholders, and that will continue to evolve in very important ways. So just stay plugged into what's going on. Softheon is obviously a resource in that regard, and we'll continue to put out content, to update everyone. But stay plugged into to the market. Mark?
Yeah, I'll jump in. I hope I'm not going to steal yours, Lindsey. But I'm going to say it's invest in broker and enablement. Brokers are your most powerful retention channel. They're on the front lines, right? Members who are facing rising premiums and confusing notices, that's who the brokers are going to be talking to. So equipping them with the right tools, equipping them with clear data, real-time support, I believe will really pay off. If your brokers are confident, your members will be confident, and that's how you can hold enrollment steady.
And I am going to talk about brokers, but I'll also just talk about communicate and educate. Those are things that are really important to me. So just getting communications out to the entire community that each of you are involved in. So through your brokers, through your provider partners, through your community channels, just getting proactive, communicating early, communicating often, and communicating in really simple, plain language that is going to resonate with people. I don't think everyone is paying attention to these changes, especially at the member level. And so the more we can do as a whole industry to share this message that things are changing, I think the better we'll be going into and through open enrollment this year.
Thank you so much, Lindsey, Mark, and Josh, and thanks to all of you who joined us live. We know that Open Enrollment 26 is shaping up to be one of the most complex enrollment seasons in recent years, but by preparing early and staying member-focused, Payviders can not only navigate these changes, but come out stronger. If you found today's session valuable, please share this replay with your colleagues, and make sure you follow Softheon for more insights. We'll see you at our next LinkedIn Live.
Bye.